Hi, I'm Dr. Larissa Pavone. I'm a pediatric physiatrist and program director of physical medicine and rehabilitation residency program at Marianjoy Rehabilitation Hospital, part of Northwestern Medicine. Our care is constantly evolving at Marianjoy in caring for patients with COVID-19. This is new for all of us. There wasn't a lot of research out there when we first started, and so really how we started was reviewing what was available, talking to other experts and other colleagues around the country, and set up some care guidelines. So we were constantly paying attention to what we were doing here and what our outcomes looked like, as well as looking at what was evolving in the community and in the world with this virus and applying that new information. In regards to the patient variables that we saw with patients with COVID-19, what I found so interesting was how we evolved in our care for them. When I was first on service in April, when we admitted those first few patients, the patients, in my eyes, were relatively healthy, middle-aged individuals who just had high blood pressure or, high lipids, nothing really significant with comorbidities. But then just 4 weeks later, when I came back on service, the complexity of the patients that we were caring for had greatly increased. So I was seeing people who had transplants, who were dialysis-dependent, had oxygen needs at baseline, and really looking at how complex the patients were who were now surviving and we were able to help was remarkable how quickly that moved. Outcomes were a key factor that we were paying attention to when we were caring for patients with COVID-19, and we had to adjust based on what these outcomes were. Fortunately, I think because of the great team that we have here at Marianjoy, when we were looking at gains that the patients were making in the care tool and functionally how they were doing, we had set some benchmarks of what we expected to see, but we really exceeded those expectations with how these patients were doing, and I think that's just a testament to the teams here at Marianjoy. I'm really excited about the research that we're working on with COVID-19 and rehabilitation. We're partnering with other hospitals affiliated with Northwestern Medicine and creating a really large database so we can really put out some large comprehensive studies for COVID-19 rehabilitation. Looking at how we were caring for this patient population, looking at the gains, looking at the different demographic factors that may affect these patient outcomes, as well as functionally how the comorbidities may affect them as well. Advice that I have for other physiatrists who are looking to set up COVID-19 rehabilitation is do what we always do and do what we're really good at, and that's collaborating with our teams. Seek out research, seek out people who have experience with this, and make sure that you have strong programs that you have developed in pulmonary rehabilitation and dealing with patients with severe deconditioning.